My name is Nicole. I'll be doing your physical exam today. Could you please state your full name and age?
Madison Hilliker, 18.
Madison is alert and oriented times 3. Her nutritional status appears appropriate for her age and body build. Madison is sitting upright. She appears to have good posture. And no obvious physical deformities. Madison's facial expressions are appropriate for age and cognitive ability. Madison's mood and affect appear calm and appropriate for age. Madison is attentive. She appears well groomed and has good personal hygiene. Madison, I'm going to begin the physical exam by inspecting your skin. Madison appears to have multiple tattoos, small in nature. She does appear to have a nose ring and multiple earrings in bilateral ears. There does not appear to be any open wounds or lesions or rash. I'm going to move on to inspect your head. Madison's head appears of normal size. Her face appears symmetrical, and there's no obvious physical deformities. May I touch your hair?
Yes.
Her hair appears well distributed. There's no bumps, lumps that can be noted. Madison, can you clench your teeth for me? Can you stick out your tongue for me, please? Thank you. I'm going to palpate your sinuses. Any pain when I'm palpating here?
No.
Any pain when I'm palpating here?
No.
I'm now going to take a look at your eyes. The external features, the eyebrows, eyelashes, and eyelids all are intact and within normal limits. I'm going to take a look now at your conjunctiva. They are pink and moist in nature. I do not see any type of redness in the eye itself, any inflammation, and Madison's eyes appear to be blue. Okay, I'm now going to check your corneal light reflex. Come across the right eye does constricted light, and left eye as well. Madison, now I'm going to have you focus on the pen. Keep your head still if you can. Her pupils are round, equal, reactive to light, and accommodate. I'm now going to have you read this card. Hold it about 12 inches away from you and cover your left eye first. Please read the first sentence.
The sky is blue.
Perfect. Now please cover your right eye and read the second sentence.
The dog is brown.
Perfect. Thank you. Okay, I'll take the book back. Thank you. I'm now going to check your ears. First, I'm going to inspect. I'm going to pull your hair back. Your ears. There's no obvious deformities. She does have multiple piercings. Now I'm going to palpate the auricle and tragus. pain or tenderness when I do that?
No.
Okay. I'm gonna come on this side now and do your right ear. Just inspecting. There's multiple earrings and piercings. So I'm gonna palpate. Any pain or tenderness with that?
No.
Now I'm going to come to your nose. Your nose is symmetrical to your face and in the center of your face. It does have a piercing. I'm going to plug each side of your nostril one at a time, and I want you just to breathe normally. Her nares are patent. Okay, well now we're going to be moving on to your mouth. Her lips appear pink and moist, no obvious deformities. Can you please open your mouth and say ah? The gums and tongue appear to be moist and pink, no obvious lesions. Her teeth all appear to be intact. Okay, say ah really, and then open your mouth farther. Tonsils are 2+, and uvula is midline and rises and falls. Thank you. I am now going to look and observe your neck. No obvious deformities or lesions noted. I'm going to have you do range of motion. So with your neck. So if you could please tilt your head back, forward, then side to side. And then I'm going to put my hand here. I want you to push your head against it. Okay, good. And then what about on this side? Any pain or tenderness doing those things?
No.
All right, perfect. I'm going to have you shrug your shoulders. Any pain with that?
No.
Neck and shoulders appear to be equal in strength. I'll now be assessing your lymph nodes. First, we're going to do your pre-auricular, your post-auricular, your occipital, your posterior cervicular chain, then your anterior cervicular chain, and back up.
Go.
The tonsillar, the submandibular, the submental, and the subclavicular. There does not appear to be any swelling of the lymph nodes. I'm now going to test the carotid vein. I'm going to hold one side and check the pulse on it. I'm going to hold one side at a time. The pulse is 2+, and the trachea is midline. Now I'm going to move on to, we're going to start with your chest, but I'm going to do the posterior side of your chest. So if you'll turn so I can have access to your back. There is no obvious deformity of the posterior chest. Patient appears to be breathing with equal and no respiratory distress. I'm going to check, I'll place my hands here and then you'll just breathe normally. Chest expansion appears to be equal and full. I'm now going to test something called the tactile femulus. So I will be putting my hands along your back, and every time you feel it, you'll just say the word 99. Okay. I will now percuss your back. You tell me if there's any pain. I'd like you to breathe normally, and I'll be testing to see if there's any dullness. No dullness noted. Was there any pain during that?
No.
I will also percuss over each kidney to check for CVA. Any pain?
No.
Any pain?
No.
Okay.
I'm now going to auscultate or listen to your lung sounds. So please, just breathe as normal. The lung fields are clear. I'm going to have you turn back around how we were sitting first, because I will be now looking at your anterior of your chest. There does not appear to have any deformities. Looks like equal expansion. No barrel chest. No roundness noted. Okay, now I'm going to listen to your lung sounds from the front. Every time you feel me move, if you'll just breathe in and out. Lung sounds are equal and clear. Now inspecting the precordium, does not look like there's any obvious deformities. I'll now begin to palpate and look at the apical pulse, which is the by the fifth clavicular. Sorry, that was the fifth intercostal space along the midclavicular line. Now palpate. There does not appear to be any type of mass. The pulse seems to be 2+. I'll now listen to your heart. You can breathe normal for this. The heart appears free of murmurs and has a regular rhythm. Now I'm going to check your upper extremities. Just looking, it looks like there's no obvious deformities on the shoulders, arms, hands, besides the small tattoos noted earlier. I'm going to check for capillary refill. Noted that her fingernails are painted white. Capillary refill is present, appropriate for her nail bed is appropriate for skin tone. Going to check the radial pulses, one at a time. Both are equal and at 2+. Now I'm going to have you do some range of motion for the upper extremity. If you could please put your arms out, and then to the side, up, and down. I'm going to have you lay flat, so if you can come over here. Her abdomen does not appear to have any deformities. It appears to be flat. Are you having any pain right now with your abdomen?
No.
Abdomen. Okay. I'm going to listen first. Vowel sounds are present in all 4 quadrants. Now I'm going to do a light percuss. Any pain with that?
No.
Just do it a little bit deeper. Any pain with that?
No.
I'm also going to listen to see if you have any type of aorta bruit. None noted. Next, we're going to move down to the lower extremities. She appears to have equal length in legs, no obvious deformities, lesions, no noted bruises. I'll now check the dorsal pedis and pulses. And the posterior tibialis pulses. Okay, now I'm going to have you do range of motion with your legs. We'll start with this side first. I'll have you lift it straight up if you can. And then I'll have you bend. And then we're going to abduct, so out. Adduct in. Okay. and then straight out. Now we're gonna do the same thing with the other leg. Straight up, bend. If you can do an abduct a little bit, and then adduct and together. Perfect. Okay, I'm gonna have you come back over to our chair. You'll have a seat. Now I'm going to check some of your reflexes. I want you to close your eyes, keep them closed, and I want you to tell me where I'm touching you with this cotton ball.
Cheek.
Which one?
Left. Right cheek. Left arm. Right arm. Left forearm. Right forearm. Left hand. Right hand. Left knee. Right knee. Left leg. Right leg. Left foot. Right foot.
Okay, perfect. Next, I'm going to have you take the heel of your one foot and run it down the shin of your other. And then do it that again. Perfect. Okay, now I'm gonna have you go flip your hands in and out. A little bit faster. Faster. Okay, that's great. Now I'm going to check your reflexes. I just want you to stay as relaxed as you can. Now down to the patellar. Down to the Achilles here. Okay, I'll have you lift your foot up. Just relax it. Okay, reactive to reflexes. Okay, next we're gonna test your gait. So I'm gonna have you just walk to that vacuum there. Gait is equal and appropriate. On the way back, please walk heel to toe. Perfect. I'll have you still stand up for now. Now I'm gonna have you, like that, keep your feet together. Put your arms out like this, and then I'll have you close your eyes and try to lift one foot up. Okay, try again. Perfect. Okay. And then now, if you want to step over here, we're going to check your range of motion with your spine. So I'll have you lean all the way forward, all the way back, side to side. Now I'll have you twist. The patient demonstrates full range of motion. This concludes our physical exam. Thank you very much, Madison.
Thank you.